Back to Fox 51 today. COPD can make breathing extremely difficult. Dr. David Brickey with Trinity Mother Francis is here to tell us more about this. Good morning.
Well, good morning.
Hello. Now, some people out there aren't familiar with COPD. Can you explain to us exactly what it is?
Well, like most things in medicines, it's an acronym, and COPD stands for Chronic Obstructive Pulmonary Disease. Sometimes it'd be Chronic Obstructive Lung Disease. But either way, it's the symptoms that unfortunately many people have, that where you have shortness of breath, you have a wheeze, or you have a cough that just doesn't get better. We see this in both men and females. In men, we see this in roughly about 5% of all men, 7% of all women have COPD. Strong relationship, obviously, to the bad habits we develop, such as smoking. Also, we can see some inherited forms of emphysema, about 2%. It's a very common thing. Again, if we talk about 5 and 7%, we also see this in absolute numbers. 12 million people are diagnosed with COPD currently, but it's thought it's probably 24 million people. So we only diagnose about half the people who really have that.
So maybe also if you're working around chemicals, right? Say maybe we're in the paint and body business. Maybe some of those paint fumes could lead to that, perhaps?
We definitely see an occupational risk. We see any type of fume or fiber, asbestos and others, and we see that what we're really seeing in most diseases is not what we did today, but what we did in the last 10 or 20 years is kind of catching up with us. So most patients we see with COPD are diagnosed in their 40s and 50s, so things we've done before. But no doubt the number one cause is that of tobacco. And so obviously a bad habit, again, we should all get away from, because if we look at COPD, a very common prevalent disease, third most common reason of death in the United States behind cancer and heart disease, it's one of those also that we can hopefully correct. Interesting, yesterday it was announced that the CMS, the government insured guidelines, actually came out and said starting in January of this year, we can actually have a screening test for lung cancer, and that's going to be a CAT scan. And what that means is if you're over the age of 55, if you smoke more than a pack of cigarettes for 30 years, and you have a history or family history of cancer, that's actually going to be paid, just like we heard earlier about such as a colonoscopy. So an X-ray, a non-invasive test to look for lung cancer, a very big, a very important breakthrough.
No, that's some great news. Now, say someone has COPD, what treatments are available?
Well, there are some interesting things, and in the last couple of years, we've now got medicines down to once a day as far as preventive medicine, and then rescue medicines that can be used every 4 hours. What we really want to do is control and calm down that inflammation of the lungs, and by doing that, we can decrease the restriction and decrease the symptoms. So we really focus on symptom relief.
Wow, so people obviously have to be careful. Now let's think about weather. We talked about during the break, maybe not so much weather, but other environmental pollutants, perhaps?
I think you have to think about your lung tissue just like you do your nose and your eyes, especially in East Texas. If you can feel that inflammation in your eyes and your sinuses, you feel the same thing down in your lungs, the bronchial cells. If there's inflammation there from molds, usually not as much temperature is related, but pollens and anything, just as we mentioned, a spray earlier, anything that we see or our body senses in the environment can start that exacerbation or worsening of those symptoms. Again, going back to treating those symptoms would be the key to making people feel better.
Now, we talked about men and women, both being susceptible to this. Now, is there a certain age that people are more, likely to get COPD?
We typically see the diagnosis in 40 years and above, but most of the time the symptoms have started 5 years before, where I had this last year. We start to see a pattern develop. This is where it's important that this disease be picked up by primary care doctors, because you may see one doctor here, one doctor there, but by having that constant exposure to a primary doctor, those patterns can be recognized. In women, we see that we actually found in a study this last year that women are more prone to COPD by the percentage I mentioned before, probably because of what you do in the workplace, but unfortunately at home as well, where you're using cleaning chemicals and such, where you're doing laundry maybe where your spouse or significant other has those occupational risks. And then again, we also find that usually women's airways are smaller in diameter, and also the hormonal changes that come with life.
Well, thank you so much for telling us about all of this. Very interesting.
Yeah, thank you for having me.
All right, well, coming up next.